guys, Dr. Kristie Ennis. Today I want to go over with you the proper core exercises and stretches that you need to do if you've had a spinal fusion. Now these are great exercises to do just in general if you want to strengthen your core, which kind of we all need to do anyways. So pay attention even if you haven't had a spinal fusion. But to go back to that spinal fusion, when they fuse the spine, regardless of what level it is, they're making it stable and strong. So we actually don't want to move that spine. It's supposed to be in that one position. So what does that mean? It means that we still want to strengthen all that stuff around the spine, but we don't want to flex and extend and twist into it to work on that strength, because we want that fusion to do what it's supposed to do, which is really important. And also, you want to make sure that you're stretching out some of the hip muscles and even some of these postural muscles too, because what tends to happen is this and this, you kind of flexing forward a little bit just as almost a protective mechanism for that spine. So I'm going to show you some strengthening exercises and some stretches that will help get you stronger and protect that spine. So let's get started. First things first, we're going to lie right on down. You can do this either in the bed or on the floor, depending on what is comfortable for you. Also, make sure that you have cleared all this with your doctor first. You certainly don't want to jump right into exercise after having surgery, so just make sure that you get the okay. So step number one is engage those abdominal muscles. So that's just a little tiny belly button pull in, not an arch and not a flatten, just a little pull in. You're still breathing. And doing that little kegel, those pelvic floor muscles, those are actually part of your core too. So try to do that little pull up and in there. So you should feel that really deep. That's your starting position, and this is really important to keep this position throughout these exercises. So making sure that's okay, and I usually have people start with hands on their hips. We're going to add in a little march. And what you want to pay attention to is that you're not arching or flattening your back, right? You're keeping that back in that comfortable position. Belly button is pulled in, you're breathing, and you're not moving through the hips, okay? You're keeping everything stable. When we're trying to stabilize around that spine, that's exactly it. It's around the spine. The spine stays still and things move around it. Okay, so that's kind of level one. If that feels pretty easy, again, making sure you're keeping this form, you can go ahead and do one leg, making sure you're not pushing out or changing that spine position. Both legs come up, and then it's a little extension from the hip down to the ground. I'm pressing my shoulder blades into the mat, and again, not arching my spine. If I go too far, then you can really see how I'm rocking and shearing force into that spine, and you don't want to do that, okay? From here, you could go ahead and straighten those legs, pointing the toes just to get a little bit more stretch in there too, and then alternating dropping one leg straight. Again, how low you go depends on where you can keep those abdominal muscles engaged in that spinal position, flat or near neutral basically, okay? So you don't have to get all the way to the ground. That doesn't have to be the goal. And then moving out of that position, you want to do one leg at a time, still keeping that neutral position. That's where I see people lose it a lot, is that they're just like, poof, and we don't want to do that. So to stretch some of those hip rotators, which are also muscles, like I said, that get tight, this is one of my favorites. If you cross one ankle over that leg, if this feels good, you stay right here. If you want a little more, you're going to bring that leg right up to your chest, that other leg. And if you need even a little more, you can cradle that other leg in that elbow, left elbow and right elbow. But if you feel a nice stretch here, please don't add on to that, okay? So from there, we're going to get up. And notice I rolled to my side first. I didn't sit straight up, so I'm not flexing into that spine. Stretching out the front of that hip, so those hip flexors. You can definitely put a pillow down on the ground if you need to for kneeling purposes. You could do this stretch standing as well. I find it works the best generally kneeling. So if you put one foot forward, do a tiny little pelvic tilt so that we're really extending into this hip here, and then coming forward. And really all you're trying to do, like I said, is stretch this out. You could do almost a standing lunge if you needed to, if the kneeling is uncomfortable. So I'm going to stand right on up. You don't have to get up this way, but for me this is easier. So it's almost that same position, but that back leg is straight front knee is bent. Okay, so those are two really good stretches to add. Also, squeezing gently into those shoulder blades helps open up that posture. Okay, and we're going to add 2 more abdominal ones, and you need a band for this. This is a fancy schmancy band with handles, but you don't have to have handles. So just standing up nice and tall, again, pulling in that belly button, and you're going to add just little pulses. So notice nothing else in my body is moving but those arms. So my abs are having to work to stabilize me here, okay? And then the other one is going to work kind of the side of the body. So I'm going to pull out so I have some resistance. It's going to feel like the band wants to do this and like this. Don't let it do that. That's the whole point of the exercise. So at home, you might want to have this band just a little bit higher than I have it attached here. Soft bend in the knees, and then push out. Okay, notice again, the band wants to pull me this way. That's how you're working this, by not letting it move. So it's an anti-rotational exercise. And then one last one I forgot to show you on the ground. For the butt, heels together, toes apart, and you're going to add that little hip lift. This really gets to target the butt muscles if you bring those feet in a rotated position. Feels like a Monday. Okay, so try to start with 10 to 15 repetitions of all of these exercises. They can be done daily, just make sure that you're not sore. And again, good for spinal fusion, good for everybody because it's all about the core. So thank you for tuning in today. If you liked this video, click that thumbs up button and hit subscribe for more videos to come. Thanks, guys.